Hi, I'm Patrick Jan, and I'm gonna demonstrate how to assess vital sign on the infant. Taking vital sign on a baby is important to the health of your baby. If you are checking the infant vital sign, you must check first the respiration, heart rate, temperature, weight, length, head size, and the chest size. Before we start, make sure that your hand is clean and make sure you gather your supplies like stethoscope, thermometer, the measuring tape, and the watch. Because I don't have a watch, I use a phone watch. First, I'm gonna start a respiration and make sure that the baby is calm and comfortable. And then, the normal respiratory rate of the infant is 30 to 60 BPM. Before we count his respiration, you must look for his nose and check it if it is no nostril flaring. And if you see that the baby is nostril flaring, it is a good sign. And also look at the chest if it is no chest restrictions. So the baby is good. Counting respiration is we're gonna count in 1 full minute, which is the rise and the fall of the chest. So counting 1 rise and 1 fall is equivalent of 1 breath. After you count it in 1 full minute, so that is your respiratory rate of the infant. To count the heart rate, the normal infant heart rate is to 100 to 190 BPM. So now we must find the apical pulse. So it can be found in the left center of his chest, just below the nipple. You found the apical pulse, so now you count it in 1 full minute. And then after you count it in 1 full minute, that is your heart rate of the infant. Checking temperature is very important to the baby because you will know it if the baby is sick. So I'm gonna use a digital thermometer to count temperature. So the normal infant temperature is 97.5 to 99.3 degree Fahrenheit or 36.4 to 37.4 degree Celsius. First, clean the thermometer lid and put it in the armpit of the baby and wait for it to ring. So if the thermometer is ring, you must see now the temperature of the baby. Checking the infant weight is important because it's one of the things we have to do, and we'll see if the baby is growing or not, or malnutritious. Now put your baby in the scale and make sure the baby is naked, and you can see the weight of the baby in the digital scale. So you can weigh the baby at birth and after 1 month or 2 months. To measure the length of the baby, put your baby in the flat surface area or flat materials, just like this. Now, if the baby is malikot, so grab his head just like this and put some mark there or level in the level of his head. And then grab his feet also and extend it gently and put some mark again. Then use the measuring tape to find what is his length. So the baby is 15 inches. So that is the baby infant length. To measure the size of his head, you must use the measuring tape and use the centimeter. Now the normal infant head circumference is 33 to 38 centimeter. Now grab his head up a little and put the measuring tape of his head in. Now ngayon, pulupot nyo and then malalaman nyo yung size. Now, the size of his head is 29 centimeter, which is not normal because this is a doll. Okay? So, I think the size of his head is normal because the doll is small. To measure the head circumference of the baby, use the measuring tape again, just like you use in the head of the baby. Now, put the measuring tape in the chest or use the nipple as a guide. Now, the size of this chest is 27 centimeter. So, the normal infant chest circumference is 1 to 2 cm less than in